Hello friends, today's video is on 5 warning signs of a stroke. Understanding the warning signs of a stroke is crucial for early intervention and improved outcomes. A stroke can strike suddenly and without warning, but recognizing its symptoms can make all the difference. In this video, we'll explore the top 5 warning signs of a stroke, helping you to identify them quickly and take prompt action. By knowing these signs, you can potentially save a life and minimize the long-term effects of this serious medical condition. Make sure you sit tight because we will also be explaining the meaning of stroke, causes and treatment management. If this video is what you want, hit the subscribe button for more interesting contents from us. Don't forget to like and share this video and save life. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. This can happen due to a blockage in a blood vessel, ischemic stroke, or the rupture of a blood vessel, hemorrhagic stroke. Without prompt medical attention, a stroke can result in brain damage or even death. Ischemic strokes, which are more common, occur when a blood clot blocks or narrows an artery supplying blood to the brain. Hemorrhagic strokes occur when a weakened blood vessel ruptures and bleeds into the surrounding brain tissue. Strokes can lead to a variety of symptoms, which we will be explaining in full details now. Early recognition and treatment are crucial for minimizing the damage caused by a stroke. Treatment may include medication to dissolve blood clots, procedures to remove or bypass blockages in the arteries, or surgery to repair ruptured blood vessels. Rehabilitation and lifestyle changes may also be necessary to help individuals recover and reduce their risk of future strokes. Top 5 warning signs of a stroke. Number 1. Sudden numbness or weakness, particularly on one side of the body, is a hallmark sign of a stroke. This occurs because strokes often affect one side of the brain, which can lead to corresponding weakness or numbness on the opposite side of the body. For example, if a stroke occurs in the left side of the brain, it may manifest as weakness or numbness on the right side of the body. This symptom can vary in severity. In some cases, it may be mild, causing only a slight sensation of weakness or tingling. In other cases, it can be severe, resulting in complete paralysis of the affected limb. It's important to recognize that this weakness or numbness is typically sudden and may come on abruptly, without warning. The face, arm, and leg are common areas affected by this weakness or numbness. Facial weakness may cause drooping on one side of the face, making it difficult to smile or close one eye. Arm weakness can make it challenging to lift or move the affected arm, while leg weakness may cause difficulty walking or maintaining balance. If you or someone you know experiences sudden numbness or weakness in the face, arm, or leg, it's crucial to seek medical attention immediately. Time is of the essence when it comes to treating a stroke, and prompt medical intervention can help minimize potential long-term damage and improve outcomes. Number 2. Sudden confusion, difficulty speaking, or trouble understanding speech are common signs of a stroke, particularly when it affects the areas of the brain responsible for language and cognition. Sudden confusion, this may present as disorientation, difficulty understanding what is happening around you, or feeling mentally foggy. It can be alarming and may occur even in familiar surroundings or situations. Trouble speaking, a stroke can impair the ability to articulate words properly or form coherent sentences. This might manifest as slurred speech, difficulty finding the right words, or speaking in a way that is incomprehensible to others. Difficulty understanding speech, this symptom, known as receptive aphasia, can make it challenging to comprehend spoken language. Someone experiencing this may have trouble understanding what others are saying or following conversations. These symptoms can occur suddenly and without warning. They indicate that the brain is not functioning normally, often due to a disruption in blood flow caused by a stroke. It's crucial to recognize these signs and seek medical help immediately, as prompt treatment can significantly improve outcomes and reduce the risk of long-term disability. Number 3. Sudden trouble seeing in one or both eyes is another important sign of a stroke. This symptom typically occurs when a stroke affects the part of the brain responsible for vision or the blood vessels supplying the eyes. When someone experiences sudden vision changes during a stroke, they may notice 1. Blurred vision. Objects may appear fuzzy or out of focus, making it difficult to see clearly. 2. Double vision. This can cause overlapping images or a sense that there are two of everything. 3. Partial loss of vision, also known as visual field loss. This can involve a blind spot or decreased peripheral vision in one or both eyes. 4. Complete loss of vision. In severe cases, a person may experience temporary or permanent blindness in one eye or both eyes. These visual disturbances often occur suddenly and may be accompanied by other stroke symptoms such as numbness, weakness, or difficulty speaking. It's important to note that vision changes due to a stroke are typically unilateral, affecting one eye more than the other, but they can also affect both eyes. If you or someone else experiences sudden trouble seeing in one or both eyes, it's essential to seek immediate medical attention. Even if the symptoms seem to resolve on their own, it's crucial to get evaluated by a healthcare professional to determine the underlying cause and receive appropriate treatment. Early intervention can help prevent further damage and improve the chances of recovery. Number 4. Sudden trouble walking, dizziness, loss of balance, or lack of coordination are common signs of a stroke, particularly when it affects the areas of the brain responsible for motor control and balance. 1. Trouble walking. A stroke can affect the brain's ability to send signals to the muscles involved in walking, resulting in difficulty with coordination and movement. This may manifest as stumbling, veering to one side, or being unable to walk in a straight line. 2. Dizziness. Feeling lightheaded or dizzy can occur during a stroke due to disruptions in blood flow to the brain. This sensation of spinning or unsteadiness may make it difficult to maintain balance and coordination. 3. Loss of balance. A sudden loss of balance or feeling unsteady on one's feet is a common symptom of a stroke. This can occur independently or in conjunction with dizziness and difficulty walking, making it challenging to stand or move without assistance. 4. Lack of coordination. A stroke can impair the brain's ability to coordinate movements, resulting in clumsiness or difficulty performing tasks that require precise motor control. This may include activities such as buttoning a shirt, picking up objects, or reaching for items. These symptoms often occur suddenly and may be accompanied by other signs of a stroke, such as numbness, weakness, or difficulty speaking. It's important to recognize these signs and seek immediate medical attention if you or someone else experiences them, as prompt treatment can help minimize the impact of the stroke and improve outcomes. Number 5. Experiencing a sudden severe headache with no known cause can be a warning sign of a stroke, particularly when it's described as the worst headache ever experienced. This type of headache, often referred to as a thunderclap headache, can occur suddenly and intensely, reaching its peak within seconds to minutes. Here's what you need to know about this symptom. 1. Intensity. The headache is typically described as excruciatingly severe, often unlike any previous headaches the person has had. It may feel like a sudden, intense pressure or a sharp pain. 2. Onset. Unlike migraines or tension headaches, which may develop gradually, a thunderclap headache associated with a stroke tends to come on suddenly, without warning. 3. Location. The headache may be localized to a specific area of the head or may be more diffuse, affecting the entire head. It can occur on one side or both sides of the head. 4. Duration. While the headache may be severe, it can also be brief, lasting for a few minutes to several hours. However, it's important to note that not all stroke-related headaches resolve quickly, some may persist for an extended period. 5. Accompanying symptoms. In addition to the headache, other stroke symptoms may be present, such as weakness or numbness in the face, arm, or leg, difficulty speaking or understanding speech, vision changes, dizziness, or loss of balance. It's crucial to seek immediate medical attention if you or someone else experiences a sudden severe headache with no known cause, especially if it's accompanied by other stroke symptoms. While not all headaches are indicative of a stroke, it's better to err on the side of caution and get evaluated by a healthcare professional to rule out any serious underlying conditions. Early intervention is key to minimizing the potential damage caused by a stroke.